Mike Mosquito and Maureen
Nylene.
on location giving you a pre-cap this week because we missed the week-ending recap for the Buzz because it was Mother's Day.
I know. It was such a great Mother's Day, too. We were both traveling, so
Yes.
unfortunately we didn't get to have the full experience, but it was well, my weather was good. You had trouble coming in. You almost didn't make it, so we lucked out, I suppose, by having you here.
We lucked out. I had a little Delta mishap with the weather, but it was good to be here. It was good to get in last night. And so this week, let's just talk about what's been happening. What are we going to be doing this week, and give the folks out there a little flavor of Texas.
Yeah. So this week we're going to be at Texas Regionals for the HIMSS conference. It's huge. I'm not kidding you. I thought HIMSS was just the end-all be-all, but I think Texas gives them a run for their money.
They do.
Everything's bigger in Texas.
That's right. So just think, if you went to National HIMSS, if you're doing regionals this week, you're going to get to see a lot of vendors that may have been at the big show, but you get an intimate setting with them. You also get to spend time with the providers around the state, all in one place. So remember, you coming here is about how do you get your time, not a general purpose conference.
Right. It's about the relationships.
That's right.
It's always about the relationships. We can't ever lose sight of that. But in addition to that, Mike, we do want to go back and we want to talk about some of the things that happened last week that unfortunately we didn't get a chance to talk about, and they're still worth talking about. So here's the first topic that I wanted to get your opinion on. Let's talk about overhauling EHR. So there's a lot of health systems that are in the process of either having acquired hospitals or maybe just having a large health system, many hospitals, bringing their disparate EHRs onto a single platform. Sounds great, right?
Sounds great.
Okay, but it's expensive.
Very expensive.
Way better than what I get for a shoe budget, that's for sure.
Yeah.
So could be $1 billion. I mean, it goes up to $1 billion. So
that's close to your shoe budget, too.
Yeah, I wish it was. But if you could sponsor me, I'm willing to take that. Let's go, though. Because if you're spending $1 billion on technology,
right,
just to do this with your EHR,
how much is left over for the patient?
How much is left over for anything else that you want to do?
So what it does is it puts a chokehold on the organization for a period of time because they've got to invest, they've got to upgrade, they've got to update. You do have to update your technology. Does it take $1 billion to do that? Depends on how antiquated, how much you've invested over the life cycle and lifetime of that technology that's in place right now. When you brought the four walls up, did you plan for the future or would you plan for that day?
Yeah.
And so a lot of institutions, Maureen, as you know, you manage a portfolio of technology.
Yeah.
You know, it gets dated. You have to sunset technology. Mm-hmm. You've got to go through app rationalization and get rid of all that tech debt that you have there, right? And so that $1 billion can build up over time, but eventually you have to pay the piper.
Absolutely.
So I think that as we talk about, these EHR updates, they're going to be required, but I think we're going to be squeezing that dollar. We're trying to move towards well care, not sick care, which means we need to take care of patients. How much technology is needed for those patients?
Right.
And how much can institutions consume to buy that technology, manage that technology, and put it in front of the patients?
Right. And I'm just thinking of it in terms of we're at this amazing event, and there's a lot of great partners that are out here. And certainly they've got great tech that they're willing to talk to the health systems about. If you're already spending $1 billion on modernizing your EHR, I don't know how much you have left over.
I don't know many institutions that say, you know what, we're going to drop, $3 billion on our EHR, and you know what, let's throw another $1 billion in for some new technology and emerging technology.
No.
Right.
In fact, when we're talking about how everything keeps getting constricted and contracted in terms of, well, of course we heard that there's going to be some Medicaid cuts. There's just cuts across the board, let's just be honest there. So it's just becoming less and less of an abundant situation.
3%. Everybody knows the number. 3% is for the IT team,
3%.
right? And so with that, you got to understand how much that can trickle down from technology to the patient, which is ultimately why we're in business, right?
Absolutely.
The outcomes are for the patient. So that technology needs to feed that ecosystem of care.
Yeah. So more to come on that. We don't know yet what that impact is going to be. And then I'm going to segue to the next thing because there's another piece of item in the news that we really don't understand the impact of yet. And that is the CDC has officially closed down their infection control committee. So that committee, Mike, was responsible for looking at the antimicrobial resistance that may be, and what the recommendations are. So, and I think for myself as the
You're
nurse,
a nurse.
that was where we received our guidance on how to care for those patients. It's gone. And oh no, it's worse. Emory at the end of April, they had this great program called Take It Home Tests, and patients would be able to ask for an HIV kit to be sent to them so they could test at home. And this is really sensitive. Obviously, this is a very personal test that's being asked for. Well, that also has received cuts. So when we're thinking short-term versus long-term impact, we have no way of knowing. I'm hoping that we don't have another pandemic situation. I hope the flu is good to us this coming fall.
Yeah, I don't think we have a way of even knowing that now. Will we know that the flu's good to us this fall? All right. When you don't monitor, I had a manager say this, expect to be inspected. Well, when there's no inspection, things run amok.
Absolutely.
And so that's what's going to happen if we're not monitoring our infectious control, disease management on a global scale. If we're not participating in those, at what point do our allies just figure we don't want to be notified? And now we're just left to our own devices to manage whatever disease crosses our borders, whatever disease comes in on a plane. Yeah. So you, from a nurse, you get to live this along with our other nurses in the close proximity setting. For us that are walking, doing our day-to-day on airplanes and what have you, this rings home when you've got sick people coughing on planes and you realize, should they be out? Should they be at home? What notices were given to our general population around care and the feeding of that care? And now we don't have those guards. Those guardrails are gone.
Yeah. Well, and I think it extends beyond just the care. It's easy for me to think of it from the nursing perspective. And of course, we put it in that institutional setting.
Right.
But care doesn't stop there.
No.
It extends into the community. And suddenly now you've got all of these people that are carrying these diseases, and we don't have a good form of guidance on how to stop the spread of those diseases. It can be a very slippery slope.
I think we're on that slope. And I actually flew home about a month ago with a young lady who was flying back from D.C. to the CDC. And our conversation in those few minutes together on that airplane ran chills down my spine. Why she was in D.C. and how disheartened she was about what she had to come up against in D.C. What she's not going to be able to do in the future that she knows is right. I won't out you. You know who you are. But know that there are people that are trying to fight for us and a better future to be managed with these diseases and other pandemics that are coming our way. And so the hard truth is, I hate to say it, folks, FAFO around disease management, because when it comes our way, you think people said they would never go in their house and not come out for a year. Well, it happened. They said it'll never happen again. I guess it's yet to be seen.
Yeah. Well, and hopefully they're right.
Hopefully they're right.
Hope's not a great strategy, though.
It is not a great strategy.
Okay, so then next topic.
Yes.
So in the news, there are 2 people that are suing Oracle Health, formerly known as Cerner, because they are alleging that the health system has disclosed their private health data to Google for advertising purposes.
Wow, that's a side gig, huh?
Yeah.
Somebody found their side gig in patient data.
So they're logging into their portal.
Yep.
Google is then receiving information about their appointments, their medical diagnoses, the tests that they were going to have performed. It just makes me think it can't be just 2 people.
Right. It's what you don't know, right? What's not been exposed?
Right. What hasn't been disclosed?
Right.
Yeah.
Because that patient data is, everybody knows it's the gold mine. It's the next.
It is.
It's the
That's
next
where
frontier,
the money is, right?
And so when you've got patient data and you've got people that have access to that patient data, now they've figured out how to monetize it on a personal scale, because they can see all of that personal information, financial, medical, treatment plans, what drugs they're taking. That is a gold mine of data. So again, are you watching your front and back doors on your patient data, because you're liable for that? And if you've got someone on the inside that's selling that data for monetary purposes, we've got another slippery slope in front of us. Cyber is only the beginning of it, because that's an inside attack, right? You've trusted the employees with this data. So now what kind of audit controls are in place to manage that type of leakage for bad behavior?
Okay, so then this is what it makes me think of. I'm thinking at it from a personal perspective. So that's my data. I own that data.
Right.
I didn't make a dime off of that data.
Right. Should you?
Should I? Would I be willing to share that with Google if they asked me?
If they asked you, but if they took it, should they be liable for stealing from you?
Right.
Who knows?
Those are the questions that
Lawyers get paid to answer.
so true. So true. And I just want to say that at the end of the day, this is all alleged. It's just at this point in time when we're looking at how powerful that data is, especially when we're talking about AI. I think every other conversation that we have anymore is around AI, the data, the lack of data, the biased data. We just have to be very clear about where our data is going, who is using it.
Right. And I think that at the end of the day, you have to be your best steward of your own data and make sure you understand what laws are in place to protect you and that data, and how that institution is going to use it needs to be under your control.
Yeah. Well, and I think there are a lot of laws that still need to be written in order for you to be protected.
That's it.
Yeah.
Well, thank you very much for joining us for a pre-cap of the week. This is our pre-cap that will lead into a recap ending our week at Texas Regionals. But I hope you keep buzzing, and we'll talk to you again soon.